All right, welcome to this explainer on the economic forces that truly dictate nursing practices, patient choices, and the entire overarching structure of the U.S. healthcare system. It is so incredibly easy to think of healthcare solely in terms of medicine and compassion. But the reality? The way you work and the exact care your patients receive are profoundly shaped by economics. Today, we're going to unpack exactly how that works together. So let's dive right in by asking a seemingly simple question that highlights a fundamental disconnect in our system. If you go to a local cafe, you know exactly what you're paying for, right? It makes sense. But the second you walk into a hospital, it's like the normal financial rules just completely vanish. Why is a hospital bill such a total mystery? Well, to figure that out, we have to look at the economic gears turning behind the scenes. Here is our roadmap for today. We'll be covering the economics of nursing, the nurse labor market, a very imperfect market, the health insurance problem, financing American healthcare, and finally, reforming the system. Section 1, the economics of nursing. We're starting right at the foundational level here with basic economic principles. Think about your morning routine, that very first cup of coffee. Pure magic, right? You would gladly hand over $3 for it. But by your third or maybe fourth cup, you're probably just getting the jitters. The actual value or utility you get from one more cup drops over time, eventually falling way below the cost to buy it. Economists call this diminishing marginal utility. So the crucial point here is how we make choices. We don't decide based on average costs. We balance the marginal cost against the marginal utility. You're not sitting there asking yourself, what is my average enjoyment of all the coffee I've ever had? No way. You ask, is this next specific cup worth the $3 I'm about to spend right this second? And honestly, that individual decision-making process is the absolute bedrock of all markets. When we zoom out a bit, we see that all our individual choices interact within 4 primary market structures. Your local coffee shop operates in monopolistic competition, lots of sellers offering slightly different roasts. A local utility company? That might be a straight-up monopoly. Understanding these structures is absolutely crucial to figuring out where healthcare fits, or actually where it spectacularly fails to fit into traditional models. Section 2, the nurse labor market. Because just like coffee or cars, labor is a market with buyers and sellers. Hospitals are the buyers and nurses are the sellers of their time and expertise. And just like any market, the demand for nurses slopes downward. This simply means that as wages rise, employers are going to demand fewer nurses. Why? Because eventually the marginal cost of hiring another nurse exceeds the marginal revenue that nurse can generate for the hospital. They have strict budgets to balance, so higher wages inherently limit the number of nurses they can afford. On the flip side, the supply of nurses slopes upward, meaning more nurses will choose to work as wages increase. It all comes down to opportunity cost. If the wage offered is high enough, that financial reward outweighs the opportunity cost of your lost leisure time. The time you could spend doing literally anything else. Higher pay naturally brings more people into the workforce. Put those two together, and it brilliantly illustrates a typical market. Wages and the number of employed nurses naturally balance out right where the supply and demand lines intersect. That sweet spot is the equilibrium. If wages are too high, you get a surplus, and wages naturally drift back down. Too low, you get a shortage, and hospitals have to bump up pay to attract talent. It is a beautiful, self-correcting system. Well, in theory anyway. Which brings us to Section 3, a very imperfect market, because as you know, perfect equilibrium rarely exists in patient care. If you compare a theoretical perfect market against the reality of healthcare, you immediately see that healthcare breaks literally all the rules. In a perfect market, products are identical and buyers know exactly what they're getting. But in healthcare, every single patient is unique. Plus, there's a massive information asymmetry between doctors and patients. You just can't research a complex medical diagnosis the way you research buying a new TV. On top of that, you can't just open a hospital tomorrow. There are strict licensing laws, certificates of need, and huge barriers to entry. Healthcare is pretty much the definition of an imperfect market. Section 4, the health insurance problem. These imperfections lead us right into one of the most disruptive factors in the whole system. Insurance is supposed to protect us from catastrophic financial risk, but it's evolved to cover routine maintenance, which brings up a massive issue: moral hazard. This is a fundamental problem because it totally distorts true market demand. Think about it. If you have to pay the full true cost of an MRI, let's say $2,000, you're going to think very carefully about whether you actually need it. But if your insurance covers it and your copay is only $20, the marginal cost to you is artificially low. You are way more likely to get the MRI, even if the actual economic benefit to society isn't worth the true $2,000 price tag. Being insulated from real prices like this causes a massive overconsumption of healthcare resources. Section 5, Financing American Healthcare. Now that we understand the rules and how insurance completely bends them, let's zoom out. The combination of imperfect markets and moral hazard is exactly why U.S. healthcare spending skyrocketed to an astonishing $3.8 trillion in 2019. That is 17.7% of the entire U.S. gross domestic product. It's a staggering, mind-boggling figure. It far outpaces what other developed nations spend, and it pulls massive societal resources away from other crucial areas like education or infrastructure. And this gigantic financial burden is covered by a completely disjointed mix of public and private payers. We've got Medicare for the elderly and disabled, Medicaid for low-income individuals, private insurance covering about a third of the spending, mostly tied to employment, and finally, out-of-pocket payments for the uninsured. This fragmented web makes it incredibly difficult to actually control overall costs, simply because no single entity holds all the purse strings. Which brings us to our final part, Section 6, Reforming the System. Because of these skyrocketing costs and glaring inequities in access, policymakers have been trying to fix this for decades. If we trace the history of U.S. health reform, it's a constant pendulum swing. We started with massive safety nets back in 1965. Then, as costs exploded from unchecked fee-for-service billing, we hit the strict managed care era of the 80s and 90s, where HMOs severely limited patient choices to drive down costs. Then, in 2010, the Affordable Care Act shifted focus toward broad coverage expansions and individual mandates. Fast forward to 2017, and we saw adjustments like removing the mandate penalty. It's this constant tug of war between expanding access and trying to rein in the budget. Rather than just expanding coverage, recent efforts have leaned heavily into value-based purchasing. For decades, hospitals were paid for every test run and every bed filled, which incentivized volume over absolutely everything else. Value-based purchasing finally flips the script. Now, Medicare actually measures outcomes. If a hospital has high readmission rates or hospital-acquired infections, they get penalized. But if they deliver high-quality, efficient care, they get rewarded. It's essentially a massive attempt to inject a demand for actual quality back into this highly imperfect market. So as we wrap up this explainer, I want to leave you with this. Now that you understand the true economic forces shaping your environment, the real scarcity of resources, the undeniable impact of moral hazard, and this big push toward value-based care, how will you use this knowledge to lead and innovate in your practice? Because the true scientific underpinning of nursing isn't just about clinical outcomes. It's about figuring out how to deliver the absolute best care within the economic reality we all share. Thanks so much for joining me, and I'll catch you in the next explainer.